ẹni tí ò dé kó ìrìn ẹkù kan.
Àwa ni center of excellence.
ẹni ò dé kó ìrìn ẹkù kan.
Àwa ni center of excellence.
mo ní pé bó o bá dé kó ìrìn ẹkù kan.
Àwa ni center of excellence.
àwọn òyìnbó débẹ̀ wọ́n rí tá a jẹ́ ṣe.
Àwa ni center of excellence.
Haúsá débẹ̀ wọ́n rí tá a jẹ́ ṣe.
Àwa ni center of excellence.
àwọn Ìgbò débẹ̀ wọ́n rí tá a jẹ́ ṣe.
Àwa ni center of excellence.
gbogbo Yorùbá débẹ̀ wọ́n rí tí wọ́n mú lọ.
Àwa ni center of excellence.
ẹni ò dé kó ìrìn ẹkù kan. Èkó ò ní bàjẹ́ lórí àwa.
Àwa ni center of excellence.
ọ̀pọ̀ ò bá dé kó ìrìn ẹkù kan.
The first place I went to was I think the holding bay. All of a sudden, the next day, the man just died.
Are coming in, we are in pain, we are screaming, we are shouting, we need oxygen. It's not easy. Every night, I know the number of people. I think I'm the longest staying here. I've stayed here longer than anybody.
If they can ban public outings, honestly.
The second wave of the pandemic is said to have had devastating effects on world economies, bringing with it more problems than the first wave. Despite this, many are seen not to be taking it seriously, causing the Lagos state government to issue warnings against this trend.
Exactly where they need to go to if they need oxygen.
At this press briefing, the Commissioner for Health explained that there has been a general notion that the coronavirus doesn't exist in Nigeria, hence the lackadaisical attitude experienced.
9 out of 10 people who have these symptoms will go and treat themselves for malaria first. And this is a problem because by the time we get to know about you, it's usually a week afterwards. And if you are in the severe to critical category, we're then struggling to try and make you better. If you look at the symptoms, cough, fever, shortness of breath, weakness, chest pain, loss of taste, loss of appetite, catarrh. Now, these are not symptoms of malaria.
The Lagos state government noted that 13 out of 100 people tested have COVID-19, suggesting an aggressive transmission of the virus due to non-observance of the protocols. Over 29,000 has been diagnosed, but the ministry said a lot of people have opted to treat themselves from home. As regards the protocol for travelers into Nigeria, the state government warned that those who fail to take the test after 7 days of arrival will have their passports rendered inactive.
A number of people are not showing up for the test, and we are sending out a whole logistics team to find what we call the day 7 defaulters. Some people are giving us fake contact information, fake telephone numbers, and fake email addresses. So we find it difficult to find people who have defaulted. Those of you that have defaulted your day 7 test, you've heard from the Presidential Task Force that any moment from now, your passports are going to be inactivated. So if you plan to use your passport again anytime in the near future, you will get to the airport and you will find out that your passport is no longer working.
As part of plans to ensure the state flattens the curve, the Lagos state government launched oxygen therapy centers, which will have 10 tanks spread over 10 local governments.
1 week has seen a geometric progression of infections of COVID-19 in Nigeria. Lagos is still the epicenter, recording more infections.
It is still COVID-19 in the air, and this time around, the virus has grown nastier. This is the emergency unit of the Yaba Infectious Disease Hospital, where patients are first received for immediate treatment and later sent to various wards for admission. Some of them require oxygen on the spot.
Since the new variant of the virus was discovered in the UK, many countries around the European country restricted movement into the UK. Nigeria, one of the UK's allies, refused. Rather, the government insisted travellers must produce a negative PCR test before coming into the country. Some travellers from high-risk countries find their way into Nigeria with the new variant, which doctors say it is deadlier.
Festive season, we know we've had a very hard year. People are looking forward to some kind of entertainment and relaxation, even though the government was able to put some guidelines in place. You know, people still wanted to do what they wanted to do for their festive seasons. So we expected that this was going to happen.
The second wave, they say, is more aggressive and spreads like wildfire than the first. And the vaccine, it's far from finding its way into Africa. Months ago, the ICU had few patients, most not using ventilators. But now, the use of oxygen is on the rise. These are the used oxygen cylinders from this ward alone. About 70 were used overnight. They are rolled out for refuel. Filled ones are also rolled in with the same speed. After meeting with the Commissioner for Health, who has now relocated his office from Alausa to the IDH on the directive of the Incident Commander, Babajide Sanwo-Olu.
On a daily basis, we receive up to 3,000 samples sometimes from all the local government areas. And we're trying to make sure that we sample every part of Lagos so that we have a clear understanding of where the transmission is happening in the community. And within 24 hours, the result is out. And if you're positive, then that starts another process. The process of contacting you to find out how you're doing and deciding whether we need to admit you or whether we can manage you at home.
Our first port of call was the biobank. It's one of the red zones.
You can see that they're using code.
The biobank is a containment laboratory and secured storage facility for biological samples.
This place is one of the most dangerous areas at the biosecurity environment. This is biosafety level 2. Behind that door is biosafety level 3, where highly dangerous pathogens are kept for investigation.
This is everything, different genes. So, but each of them, I can easily get their reading and tell you, okay, this is positive. The cutoff is 40. Anything below that, we'll take as positive.
This is the COVID ward.
How are you?
It was donated by the private sector-led coalition against COVID-19. Most of the patients here can hardly breathe on their own without oxygen. There are 90 patients currently receiving treatment here. 80% of them are critically ill and they require oxygen. In some cases, 6 oxygen cylinders are used by one patient daily for survival. Globally, there is oxygen supply chain crisis. The demand for oxygen overweighs the supply.
Mr. Governor has instructed that we, as a state, that we develop more oxygen generation capacity. And what you can see here today is a brand new plant, which is a collaboration between Lagos State Government and the Bill and Melinda Gates Foundation. This facility here can produce 60 large cylinders in 24 hours. That's a day. So that's very helpful and will add to our daily consumption of oxygen, which we're currently using about 300 cylinders a day.
The flow rate of oxygen for critically ill COVID-19 patients is 15 liters per minute. Now it's tripled. Our regular sick patients uses 5 liters. At the IDH, the consumption of oxygen is very high, as life of most patients with COVID-19 hangs in the balance.
It seems like it's affecting a younger age group. It seems that when you catch this COVID, that it can cause respiratory failure faster than the first wave. And we don't want people to die. So, we want to be able to admit people in a way. So the place is almost full, but we have more capacity outside and other isolation centers. So Lagos has excess capacity.
People come in breathless, and then when you measure the oxygen concentration level in their blood system, some come in with very severe oxygen concentration level. Then the organs of the body can now begin to suffer some form of damage. And this damage could actually become irreparable. Somebody coming into the hospital with an oxygen level of, say, 20%, because we've seen them 40%.
The only thing to keep their weak lungs alive is this oxygen. The struggle to stay alive is huge. It's a hard fight they must win. But others with underlying ailments like obesity, high blood pressure, and diabetes, and even chain smokers in most cases, are helpless, as COVID in most cases wins the battle.
Patients from Alimosho, Ikorodu, Ketu, Ojota, Alapere, Iponri, Epe, Badagry, Surulere, among other Lagos local council areas, are here receiving treatment. To say that COVID-19 is the disease of the rich is a fallacy. Emmanuel here is from Surulere area of the state.
It's a terrible experience. It's a terrible experience. You cannot be comfortable for anything. You are not comfortable. You don't even feel what you are eating.
This first place I went to was I think the Holding Bay.
So what did you see there?
All of a sudden, the next day, the man just died. And they said before then, somebody had died. So it's real, it's real. If they can ban public outings, honestly, and I'll give it to state government for the effort they've done so far. I would like people to mount a lot of campaign. Publicity is needed, because when I watch what happens nowadays, I still feel bad how people party uncontrollably.
People are coming in, we are in pain, we are screaming, we are shouting. We need oxygen. It's not easy. Every night, I know the number of people. I think I'm the longest staying here. I've stayed here longer than anybody. And I've watched people pass on. We need to create awareness.
Before now it was fever, loss of smell, loss of taste. But right now it's just intermittent cough right now.
There is influx of patients into the IDH, Yaba. People from other states, including the Federal Capital Territory, Abuja, Foreigners prefer to use this Lagos facility. This has no doubt overstretched the health workers.
I am quite impressed, and this space is free. And then I get here and there's a whole system that works. It's hard to run a shop like this, but it works. And this is Nigeria. I want to come back here and spend a day and clean the floors because I didn't die. Imagine if 100 people spent 2 hours to help clean the floor, to help change the sheets. It would ease the burden. These guys are under enormous pressure.
I'm from Idimo. We've been really been well taken care of here, and I can see. Yes, I was coughing.
How are you doing?
Then have a high fever and typhoid.
We're doing our
I was
best.
being treated in hospital before, and later they asked me to go and do the test. So after doing the test, they discharged me and asked me to come down here.
I'm better now. So we want to thank Lagos State. They are doing a good work. God will bless Lagos State and all the people is using. Thank you, Commissioner.
You're welcome.
I want to thank the Lagos State government, the Commissioner of Health, for everything being put up here, for the healthcare facility, for the nurses, the medical team, everybody working as a team. I want to thank them for the care rendered to every one of us. I came in very bad, but I'm well now. So I want to let the people know. I would like everybody to be aware that this thing called COVID is very real. Every day we escape by His mercies. If not for the hand of God, we would not be here today. But because of it, may we never stop wearing our mask. Whether in the bus, public transport, marketplaces, we should and endeavor to do so in where we worship. It's imperative.
48 hours before this recording, 7 people have died. More are lying on the sick bed and more stretched into the facility, showing the severity of the second wave of COVID-19 in the country. But the frontline health workers are not giving up as they fight to keep all their patients alive.
Skepticism, I don't care attitude and relaxation of safety protocols and guidelines have been said to have led many into that hall. Until people adhere to safety protocols, the second wave will not abate and the third wave might knock harder. Adedoja Salam-Adeniyi, TVC News, Yaba, Lagos.